The human service workforce in Massachusetts has been growing dramatically by 67% over the last 11 years, but with demand still rising, there is a new warning of a possible crisis with many current workers either changing jobs or retiring. That's from a report commissioned by the Providers Council. To explain is our guest from the council, the president and CEO, Michael Weeks. Thank you very much for being with us, Michael.
Well, thank you, Chris, for inviting me.
To explain this about how it really matters here, who are the people served by these workers?
Sure. Well, we have a statewide membership of community-based organizations, primarily nonprofit. They're serving individuals with intellectual and physical disabilities, people with behavioral health, mental health challenges, homeless individuals, our veterans, our elderly, children and women at risk, a wide range of individuals throughout the Commonwealth, including those who are struggling with the opioid crisis here, are part of our workforce amongst many, part of the problems that we're working on among many others.
I imagine one reason you need more human service workers as opposed to fewer is that a lot of us are getting older and, well, could be nursing homes or rehab that we have to look forward to.
Well, you hit on one of the key factors that's concerning us here in Massachusetts. We have what we think are the elements for perhaps a perfect storm. It's predicted in the next several years, at least 34% of the state's workforce is going to be less than what they are now. In fact, there's going to be somewhere in the range of 36,000 workers. At the same time, our population is getting older. And about a third of the state's population is going to be age 55 and older. And at the same time, we're going to have a decrease in the number of workers that are going to be here in Massachusetts as eligible. So we're going to have a demand, but we're not going to have enough workers to meet that demand.
What about the people who are in this workforce now? How would you describe the composition of this workforce?
Well, it's an interesting workforce. There's always people in our workforce who really care, and that, I think, what attracts them to this sector is they care about individuals. They want to make meaningful changes in their lives, and they do that by being involved in this workforce. We're primarily about 80% female, and interestingly enough, Chris, we did an informal poll survey somewhere around a few weeks ago. We found out that about 25% of our workforce currently are foreign-born.
This is BNN News, and we're talking with Michael Weeks from the Providers Council. It doesn't hurt to have foreign-born workers, as serving a population that's getting more diverse. But you sound concerned about the foreign part because we could have new restrictions on new people coming in the country. Maybe.
Exactly. We have a growing need, and that need primarily has been met over the past few years because we have had foreign-born labor that's come here and filled out the gap. So there's concern amongst our members throughout the state that without foreign-born workers, how are we ever going to meet the needs of the people here in the Commonwealth? And quite frankly, in order for us to provide services at a high level, it's about individuals. It's not going to be technology that's going to solve the problems for us. We're going to need to have committed folks who are trained and at enough levels so that we can meet all the needs of the various populations we're talking about.
Well, this report mentions certain signs of strain that we have already because there aren't enough people on the job now, and there aren't enough people who have the necessary skills. Elaborate on that.
Well, you got to think of it this way, Chris, is that, our sector is what we call the state's other first responders. They are the people that are out there if a person is homeless that needs a home. They're out there trying to find a home for them. If there's a child or a woman at risk and they're fleeing an unsafe situation, they're responding to that. They're responding to a person that might be going through a crisis with opioid problems and other drugs. So we've got the state's other first responders. So it's imperative that we have an adequate workforce there to respond to those particular needs. And without that, it puts stresses throughout our system. And that's not really the Commonwealth we want. We want a Commonwealth in which people's needs are being met.
I know these jobs give you the satisfaction of doing something essential for people who have acute needs, but on the other hand, some of them are very stressful and just sometimes just unpleasant. I mean, doesn't that make it hard to get new people to fill the vacancies?
Well, I think the people that we find are people that really care about individuals. They want to make a change in their lives. They understand that not everything that happens is going to be pretty and nice, and that some people are going to have some difficult and challenging times, and they're going to need people that are going to have to help them through that. And that's what we look for at the human services sector. We know that in many of our lives, we may need help. As we get older, we may need someone that's going to help us along and help us get things. And for that, we have a workforce that's doing that. That's what the human services sector is. This is about providing supports to people when they're in need. Sometimes it's situational, sometimes it's incidental, or sometimes it could be something by birth in which they're going to need lifetime support. But those are the kind of jobs that are important in our sector. And without them, it puts stresses on others because, quite frankly, many of the people in the Commonwealth wouldn't be able to go to work if they didn't have someone that was taking care of their loved one, that was making sure that their child was getting adequate child care or their elderly parent was being cared for. That's what our sector is about.
Well, this is a field or sector that has to contend with some market forces because a lot of people, they get some training, they might even get a degree to get one of these jobs, and after working very hard, taking a lot of stress for a few years in the nonprofit world, they prefer a state job with nice benefits and maybe better hours. How do you get around that?
Well, one of the things we're proposing, and we're doing this through some legislative actions that we're taking, filing bills to really raise the pay of the salaries of the people that are working in this field should get. We know that the pay is not what it should be, and it's not competitive. And quite frankly, we understand when people are leaving because in order for them to live in a state like Massachusetts, which is one of the states in which affordability is not something that we find easy here, that they're going to need some more pay in order to do that. So we're taking some actions in that regard to ask the legislature to provide more support, more money, and let's try to get some parity between what they're getting paid and what is really comparable pay for others. The other thing we're looking at is some relief for loan repayments. We want people that are college educated, that are really, because of the skills they need, the talents, the education they need in order to provide the care, very often they need to have a bachelor's degree. But we know that costs money too. So we're asking the state to help us with a loan repayment bill so that it makes it easier for them to be involved in our services and also help them to pay for their colleges. So those are two quick things that we're looking for. And there are other things with health insurance that we're involved in. And we have to do some work better with how do we make these jobs more attractive, to seem more attractive than what they are. So we've got work to do in that regard. But it's a great field and a great sector, and it's absolutely essential for the residents of the Commonwealth.
Ultimately, a lot of these jobs are funded from the state budget, the state's struggling to contain healthcare costs, and now we have the federal government maybe cutting Medicaid, who knows? I mean, how are you going to get the money for this?
Well, you asked a good question about that, and that's going to be a challenge. I think for us, what was important is first to outline we've got a crisis here, and I think it's important for people to know there's a problem. And that problem is a crisis for some, it's at the precipice of a crisis for others, and if we don't do something about it, all of us in the Commonwealth are going to be affected by it, and not just some of the population. So we've got to get the commitment that recognizing that not only there's a crisis, but we got to figure out ways to solve that. So like so many things involved in there, it's really going to be a question of priorities. Do we want the Commonwealth to be the place in which we've said it is and what it believes, a place that in which all of us can grow and reach our full potential? And if that's the case, then we've got to make the right investments in there and change things in a way that make this particular field more attractive and one that can sustain a real great workforce.
Finally, Michael, we should mention that you have the report online, and of course you have a website for the council that people can check out.
Sure. Providers Council's website is www.providerscouncil.org.
Thank you very much. From the Providers Council, Michael Weeks.
Thank you, Chris.